Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit my playlist. In the playlist, I have provided almost all the topics in a very systematic order. You can make use of it for your continuous study purpose. My dear friends, so as usual, today also we'll discuss about a short topic of importance. We know that autism is increasing day by day in the society, and if you compare in the last 3 or 4 decades, the incidence of autism is deliberately increasing, and it is quite pitiable condition for the parents. And many of the times the autism has been diagnosed late. Usually autism is a disease of the early childhood. That means usually when the child is going to LKG, UKG, or then the first standard, the teachers usually identify that child is not doing well and the child is not responding for their commands and all. Then usually they complaints with the parents. Then parents come to know, and then they will go for a opinion, and then ultimately it will be diagnosed as autism, mild, moderate, or severe. So when you diagnose the autism case so late, that means at the age of the 4 year or 5 years or 6 years, etc., then chance of recovery rate is also very less. Chance of recovery rate is also less because, so we have been proposing a concept of neuroplasticity. Neuroplasticity basically refers to stimulation of the collateral pathways in the brain system. We know that autism is a disease with the sensory block. That means auditory, visual, or some other any sensory inputs which has been given to the brain that has been not processed further, and that leads to autism. And child is motor aspect, child is fine, but as there is no sensory input, so child is not able to show the motor response according to the sensory input. So if you are asking the name of the child is not able to tell the name because he is not receiving that particular sensory signal of asking question itself. Similarly with the visual, and similarly with the other sensations also. That is the main problem with the autism. But when it is diagnosed at the later part of the life, that means later part in the sense 4 years, 5 years, or 6 years, the chance of providing this neuroplasticity is also less. Neuroplasticity means if you are giving continuous stimulation, sensory stimulations, although the traditional pathway of that sensory pathway is not working, because of continuous stimulation there is all the possibility that some other neuronal circuits will go to develop, and that function will be taken by that particular extra developed circuit. So that is the concept of neuroplasticity. Only important thing for this is you have to give continuous stimulation. It may be in terms of talking, it may be in terms of any other sensory signals. Now the question comes, if it is diagnosed late, as the brain development completes after at the age of 2 years, maximally the brain development completes up to 80 to 90%. For the next 2 or 3 years, brain development will be there up to 20 to 30%. But after 6 years, the brain development is negligible. Brain growth is almost all, growth and development is almost all negligible. So this being the case, what is very important is diagnose the autism at the earliest. At the earliest means, if it is possible, diagnose the earliest on the first month of life. If possible, diagnose the autism in the first year of the life. So if you are able to diagnose this autism in the first month of the life, or at least in the first year of the life, and you identify the disease condition and start the treatment accordingly, then you will have a chance of getting good benefits, good results also. Now here this is the point where Ayurveda shows its superiority. Why I am telling is, there are so many concepts in Ayurveda which is related to this particular early diagnosis of autism. So concept number one is starting with the what you say lori. In Kannada it is called as jogula or lali hadu. In English it is called as lullu song. It is a common practice in India, especially Indian tradition and even in Ayurveda, that usually to make the baby sleep, we usually sing a song. That song is called as a lori in English, Hindi, lullu song in English, and jogla or lali hadu in Kannada. Now you can ask, what is the importance of this? It has got a significance. See, suppose the child is responding for your lullu song or lori, that suggests that child is able to appreciate the auditory stimulus which is provided by you, and although the auditory capacity of the child is also absolutely fine, so child is enjoying your song and child is sleeping. Child is going to sound sleep. Now suppose we know that what actually happens in autism. Two main domains are get affected. One is social domain and another one is language domain. These are the two important domains which is get affected. Now if the child is not responding for your lullu song or lori song, that suggests that the auditory capacity of the child is not good or affected, and it is not responding for that. Suppose when you are singing a lori, if the child is crying more and more or irritable more and more or not at all sleeping at all, that itself suggests that the auditory and visual capacity and social developmental milestone is lagging behind. So this is what I mean to say, that when you sing a lori song to make the baby sleep, if the child is not responding properly, a wise or clever mother can identify this, or other family members, old family members can identify this. Otherwise, usually child will respond for this lori song if all the sensational part, sensory part is intact. So this is the earliest diagnosis. In the 1 month itself, first month itself, you can go to diagnose the autism. Okay, of course, if the child is not listening, there are some other possibility also there. Child may be also having deafness, child may be also having some other mental psychological problem. They are the different issue, but this is also one of the method. This can be also used as one of the method of early diagnosis of autism. Number 2, Vedanadhyaya has been mentioned in Kashyap Samhita. Vedanadhyaya is nothing but neonatal symptomatology. Different symptoms has to be observed. It is not about the disease. You need to identify different symptoms. Okay. Now, when he explained under one heading, that is Unmada and Apasmara, he explained two important things. In Apasmara, he says Akasmat Attahasanam. That is, child is suddenly laughing without any reason. Child is suddenly laughing without any reason. Akasmat Attahasanam. Number 1. So now we have to see, suppose if the child is laughing himself or herself without any reason, that means he is not responding according to the sensory stimulus. Suppose if you ask the child what is your name, or you say something funny with the baby, and child is responding for that in the form of laughing, it is okay, agreeable. But you are not telling anything, but by himself or herself the child is laughing. So that means this is called as solo play, which is later develops in case of autism. Okay, so he is talking or try to give the emotions without any sensory stimulus by his own. Similarly, in the Vedanadhyaya, he explains one more important thing, that is Pralapa, Arati and Vaichitya. Pralapo, Arati, Vaichityo. Okay, so this is the symptoms of Unmada according to Kashyapa in Vedanadhyaya. So what do you mean to say that if the child is Pralapa, that means irrelevant talk, child is not talking according to the sensory stimulus. Okay, by his own or her own, she is talking irrelevantly. Then Arati, child is dull. And Vaichitya, unstable mind. So all these three are considered to be either the symptoms of autism or early symptoms of autism, or maybe the early symptoms of ADHD also. Therefore, Kashyapa explains this in Vedanadhyaya. The child who is not able to talk and express, identification of the disorders in such a child is explained under the heading of Vedanadhyaya. So we are explaining the Unmada and Apasmara. We should not take the adult standards of Unmada and Apasmara here. Consider simple psychological conditions. Okay, child is laughing by himself. Akasmat atasanam. That means definitely the child has got some psychological problem. What may be the psychological problem? Maybe ADHD, maybe mental retardation, maybe autism, maybe other symptoms or other presentations. Similarly, when the child is having pralapa, arati and vaichitya, there are wide range of psychological problems, neurobehavioral, neuropsychological problems might have been involved, but one of them is also autism. So this is how you can identify this autism in the beginning itself if you employ the clinical aspect, apply the clinical aspects of Vedanadhyaya with respect to Apasmara and Unmara. Similarly, there is one more tradition which is mentioned in Ayurveda, that is samskara. One of the samskara is Nishkramana samskara. Nishkramana samskara is carried out in the 4th month. What is this Nishkramana samskara? It is early exposure, that means it is exposure of the baby to the outside for the first time. According to Ayurveda, you should not expose the baby to the external environment, that means outside. You should not travel along with the baby till 4 months of life. Okay, first 4 months of the life, because we always believe in gradual exposure of the baby to the external environment. Initially child was there in Suchikagara, then child comes to the home, then from the home child comes to the courtyard of the home, that is what is say Suryodaya Darshana Samskara. Then in the night child is exposed Chandrodaya Samskara. Then in the 4th month child was taken to outside. That means you can travel along with the baby to an outside area other than the home environment. So that has been explained. In that context, Nishkamana Samskara, what Ayurveda explained is, first time when you are traveling outside with the baby, you have to take the baby to the temple. Okay, you can take to any other holy places. Okay, so to the temple. Now during Nishkamana Samskara, that is in the 4th month, usually social smile is developed. Complete social smile will be completely developed. In the end of the 2nd month itself it starts, 3rd month it completely develops, and the 4th month completely develops. Okay, when you are taking the baby to the outside, on the 4th month, child is having social smile. Now child know how to show the emotions like afraid, scared or surprised, and child is very eager to explore the world in these 4 months of age. So when child is taken outside and show to many people, okay, so many strangers will be there or unfamiliar persons will be there when you take the baby outside, and you should watch what is the reaction of the child, whether the child is crying, whether the child is happy, whether the child is scared, okay, or whether the child is stick to the mother itself, okay, or whether the child is looking here and there eagerly try to explore the world. So these are the very important things. Now suppose if the baby is having autism, this is happening in 4th month. If the child is having autism, starting from social smile, there is no any such emotion shown when the baby is brought outside the home and exposed to some of the unfamiliar persons. So Nishkramana Samskara in the 4th month is doing this job. So this is the importance of Nishkramana Samskara, which is explained in our Ayurveda for the early diagnosis of autism. See, so many methods are explained for the early diagnosis of autism. Once you diagnose the autism early, you can plan the treatment early, and the chance of getting recovery is also early. So beautifully explained in our science. Number 1 is there is a concept of what you say, the Rory. Number 2, there is a concept of Apasmara and Unmadara, which is explained in the Vedanadhyaya. And third one is Nishkramana Samskara, when the baby is taken outside for the first time in the 4th month and exposed to so many unfamiliar persons. And now we will watch the reaction of the baby. Okay, an autism child may not give any reaction. ADHD child may also not give any reactions, or maybe overreactions, hyper responsive. Okay, a psychologically deprived person or some other cognitive problems, child may not identify any people, and there is no response. Sometimes baby may be dull, sometimes maybe not interested in the surrounding at all. So it's such a beautiful occasion or method of identification of autism at the earliest. Not only autism, so many other cognitive problems at the earliest part of the life. The reason is very simple. Benefit is very simple. If you identify at the early part, the chance of recovery is also high because brain growth had to take place. This is only the 4th month. Now we have got a lot of time for the recovery, or neuroplasticity can occur if you employ the right methods. So this is so beautifully explained in Ayurveda about the early diagnosis of autism This is all for today. I hope you enjoyed. Thank you very much.